Okay, we'll go back.
All right, great. Let's do it.
CT scan. This is actually the basis of a lot of our diagnostic procedures.
It's the spaceship.
Woo! It
So
does look like a spaceship.
this is our CPCT scan, and we can adjust that for any age of patient, any height of patient.
I love it.
It's a neat scan. It's very low radiation. It takes a 3D image, and the scan takes 10 seconds.
Awesome. So let's see what you get to see once you do the scan.
So once we do the scan, it takes probably another 2 minutes to materialize here on our screen. And so usually the first image that will show the patient is their 3D image. And we can change the contrast of this so we can pick up different parts of the anatomy. We'll look first of all for the symmetry of the face, and we can turn it around. We can look at the TMJ, and this is for any age. You see how that TMJ just shows right up there. We look at the spine. A lot of people have neck issues that they didn't know about. They thought their neck issue was just fine. But we'll look at that neck, and we can see if this spine is straight or not. And I'd say 50% of the time it's not, and about 25% of the time there's a severe derangement there. And part of the issue the patients have, and that's when we'll start to use the chiropractic. And we can turn this any way that we want, and it's incredibly helpful. We see a lot of different issues when we do that.
That's awesome.
So then the other thing that we do is that we look at, this is taking a slice right through here and laying it sideways. You can see the nose, eyes, teeth, and the airway. So the airway is a big issue. And so we want to line up on that airway. And we line up on the most narrow part because that's going to be the restrictive part. We're not going to get any more air through there than the narrowest part of that airway, just like your garden hose. So this is right behind the tongue. And this is a male patient, and so with children, etc., the concept is the same. The numbers are a little bit different.
Okay.
So we'll measure that. It should be 11 millimeters. So we'll measure that, and it's 3.9 millimeters. Well, they're getting approximately 15 to 20% of the airflow that they should.
Wow.
So now we take this scan, and we'll take it and take a look, and we'll go right through let's take an air, let's do this. So we'll go right through the nose. So we'll bring this line out to the nose right there, and we're going to go right back through the sinuses all the way to the spine.
And journey through the airway, right?
Journey through the airway. Journey through space.
Yes.
Okay, so there's the nose. It's the tip of the nose. And we'll make that a little lighter so it's easier to see. And now we'll start going through the nostrils. You see that this is the left side, this is the right side. We'll see this is a little bit closed here, so we might think that that's going to be, and there that should not be closed there. That valve is closed. That's going to restrict airflow. Now here's the front teeth coming into sight. These are the frontal sinuses up here. These are the maxillary sinus. This is really important. So as air flows through here, the maxillary sinus has nitric oxide flowing in there. And if you're not breathing through your nose, then you're going to be depletion of nitric oxide has a multiplicity of benefits for you. It's incredibly, breathing through the nose cannot be emphasized enough. And that's why we're so adamant about what we were saying about the mask issue. So here, as I'm looking here, now here we see this inflammation right here in the sinus. Patient most likely doesn't even know that they have that. And we'll sometimes see these sinuses totally filled up, one sinus totally filled up, like that one little piece was. And now we're going all the way back. These sinuses, these airway, should be 3 millimeters. Let's see what 3 millimeters looks like. That's 1.5 millimeters.
What?
This looks like a spider web compared to what it's supposed to.
Yes.
This patient is deficient of air. I mean, I just no two ways about it. And it's not uncommon that we see that. And we just continue to go back and back. Now we're at the back of the throat here. And we can go back. Here's the TMJ right here. Heard of the TMJ. And we just keep going back. There's the end of the spine. This is called the axis. That's what the head spins on. That's the vertebrae the head spins on. And so we'll look at the alignment of those to make sure that they're lined up. This is not our field of endeavor, but
It's telling.
It's a screening.
Right.
So who do we need to go see to, this will help, but I need this guy or this girl or whoever is
Right.
that person to help with this so that we can have a good solution for this patient.
Right.
This is the CBCT machine, and so we can adjust this to the patient. And there's so little radiation, we don't use jackets on here. And I'll have you step up a little bit closer because we want you to be as vertical as possible so we get an accurate view of your airway. If you lean too far forward, we're going to open up that airway too much. So we'll then lean your head forward. Okay, now what we do now is I'll go over to the computer and I'll actually line this machine up so that you're aligned horizontally and vertically, and once we get that alignment done, then we have you just breathe through your nose, close your eyes, swallow, and keep your teeth together so that everything is absolutely stable. And then this arm will swing around. It goes around one time, takes 10 seconds, and bang, we have our scan.
Nice.
Yeah, much more simple than a CAT scan, a lot less radiation. The CAT scan goes around and it's shooting an X-ray every time.
Oh, yeah.
So a lot less radiation.
Awesome.
So this has become our mainstay in our office, the traditional, what we call full mouth series of X-rays or panographic X-ray. We don't do very much anymore.
Yeah.
There's no shortage of patients that need this, and especially there's no shortage of little kids that need this. So we really want to, as I said, be missionaries of that word.
Right. Awesome. Well, thank you so much.
You bet. Thank you, Angie.